Welcome to the Midlife Maverick podcast, where we empower men in their prime to redefine what it means to thrive beyond 40. Join us as we navigate the complexities of midlife, offering insights, strategies, and inspiration to reclaim your health, vitality, and purpose. From personal stories of transformation to expert interviews and actionable tips, each episode is designed to support you on your journey to live your best life in your midlife and beyond. Get ready to unleash your inner maverick and embrace the adventure of aging with grace, strength, and purpose. Let's dive in. My guest today is osteopath and functional medicine practitioner, Dr. Rick Davids. Rick and I both studied under Chris Kreser's ADAPT framework, and I discovered Rick while searching for a functional medicine practitioner in Melbourne. Rick and I share a lot of the same ideas around health and well-being, and we've had some great conversations in the past. So I thought it would be a great idea to invite Rick onto the first episode of Midlife Mavericks and talk about the differences between conventional medicine and functional medicine. We joined the conversation with Rick reflecting on his own childhood and his journey to becoming an osteopath and functional medicine practitioner.
I grew up pretty unhealthy. My mum and dad actually separated when I was quite young, and my mum was always on income support and struggled to make ends meet. And as a result, we were kind of on the breadline a lot of the time, and food quality certainly wasn't a big part of my upbringing. So I was a bit of a sick kid, you could say. I was quite overweight, had chronic asthma, lots of allergies, and I remember having fungal skin infections and all sorts. And I wasn't really particularly health inclined at the time. And I ended up at the ripe old age of about 11, starting smoking. Believe it or not, well, looking back, it just sounds like really terrible, but that was it. Just influenced by the peer group at school, and I really didn't take school too seriously. And I played truant quite a lot, which we used to just call bunking off, and ended up finishing school at 16 without really much in the way of qualifications, and ended up landing myself a job on an assembly line building shower pumps and eventually building double glazed windows, which I did for a few years. And somehow I ended up sort of leaving that line of work and worked as a sales assistant in a fitness shop, which came up in Brighton, the city that I was kind of living close to at the time in England. And as part of this role as a sales assistant in this fitness shop, we had access to a local leisure centre. It's actually like a health club. You get free membership, basically. So I started using the gym, and that was my kind of first real exposure to sort of fitness, and I really enjoyed it. And I remember one day there was a big poster on the wall at the gym advertising a fitness instructor qualification through the YMCA, and I remember just thinking, yeah, I could see myself as a fitness instructor. So I ended up borrowing some money off my mum, and I attended the course, which I think it was about 6-week intensive course. When I qualified, I ended up landing a job, actually a full-time position at my local leisure centre, and started working as a fitness instructor. So that kind of got me into the whole fitness thing. Now, all the way through this, by the way, I was still smoking about a pack of 20 cigarettes a day, right? Can't believe it when you look back. And I remember as part of this fitness instructor role, we had to wear a polo shirt, kind of like this. And across the back of it was fitness instructor printed in bold black letters. And I'd kind of walk to work and I'd be smoking a cigarette, and people would be driving past me on the way to the gym, tooting their horn saying, hey. And I was just extremely sort of shameful, just trying to hide the fact that I was smoking. And I just thought, this is just completely not in line with this sort of fitness identity I was supposed to be having. I felt such a hypocrite. And that was a big reason why I ended up quitting. Anyhow, during my time at the gym, I just developed more and more of an interest in health, nutrition, in corrective exercises, rehabilitation. And I started to get really keen to perhaps maybe pursuing a career in something along the lines of physiotherapy. So I remember calling up the university, spoke to admin there, and I just asked about the entrance requirements and so on. And they were like, sorry, Rick, you don't meet our requirements because you don't have any A-levels in maths, English, sciences, and so on. And I was like, oh yeah, maybe that's why I should have went to college. But that didn't stop me. I ended up actually doing what's called an access to higher education course. It's like a bridging course at a college near me. And it was a commitment of 3 days a week. And I was doing this around my full-time fitness instructor position. And it was just really upskilling us, getting us ready for university. So I learned all the basic sciences again, bit of an emphasis on biology. And so I got stuck in, and I was really passionate about my education at that time. And I did this access course. Now, alongside doing this, I was introduced to a guy called Paul Chek, who at the time in the fitness industry was sort of shaking up the industry a little bit. And he wrote a book called How to Eat, Move, and Be Healthy. I think I've still got it. This is kind of the book here, right? This one is a game changer. Really, really kind of, I'd say, opened my eyes and certainly did influence and change the trajectory of my kind of career path, I think. But anyhow, so it's all about health and nutrition and so on, but very, very different to the information I was reading at the time, much more holistic. And so I applied all the principles to my own health, and I noticed a huge improvement in my energy and my cognitive function in particular. And I was so inspired by the book that I actually attended the course that was sort of associated with the book. At the time, it was called Nutrition and Lifestyle Coaching course. And so I attended the course, and on that course, I actually met some osteopaths. And I'd never heard of an osteopath at the time, never knew what one was. And they managed to convince me that osteopathy was a far better career path than physiotherapy. And so I did a little bit more research, and I went to actually see an osteopath for treatment. And I thought, you know what, this really does resonate with me a lot more than physiotherapy. So I ended up changing the degree to osteopathy instead of physiotherapy. And by the way, during the course I was doing, that was really the first time I was introduced to some of the functional medicine principles, and was actually where I first heard the term functional medicine. So that kind of like planted the seed, although at the time I didn't really look much into it. Anyhow, trying to cut a longer story short, I ended up enrolling at the British School of Osteopathy in London. Absolutely had a blast, loved the course, was passionate, and I graduated there with distinction. It's where I met my wife, who's also an osteopath and my business partner, and had an absolute great time. And throughout the training, I was also working as a personal trainer in London to sort of finance my way through that. And as I got stuck into work when I graduated, I was reading a lot of the old classical osteopathic texts, and they were always talking about the importance of nutrition and the environment, the lifestyle factors, and so on. And I kind of remember feeling a little bit sort of disenfranchised, because the course I just did was, although it was awesome and allowed me to become a great diagnostician, and I learned some really good hands-on manual therapy skills, it really kind of only gave a bit of lip service to the importance of nutrition and lifestyle and an environment. And so I thought, you know what, something's missing here. And then I remembered functional medicine, and then I kind of took another look at that, and I thought, yeah, this is the missing piece of the puzzle. And so I did a couple of other trainings in it. I remember doing the first one was called FDN, Functional Diagnostic Nutrition. And this was a really good introduction to functional medicine principles. And I learned how to run some lab work and design nutrition protocols and supplement plans for patients. And as part of that course, I had to actually run all the tests on myself. And I, soon realized that I probably burnt myself out through university. And at the time I was doing silly exercise training through CrossFit. And, I was absolutely burning the candle living in London and that kind of thing. And I was feeling a lot of fatigue and brain fog at the time. And my digestive system was a little bit off. And anyhow, through the testing, I realized I had very low cortisol output, the sort of quote unquote adrenal fatigue, or what we call HPA axis dysfunction nowadays. I had a nasty parasite infection called Giardia lamblia, which was likely something I picked up in Thailand. And I had a bunch of food sensitivities. And I felt like I knew a lot about nutrition at the time, having done my nutrition and lifestyle coaching courses. But this was just a bit more of an eye-opener, because we had this objective data through testing. So I applied the protocols to myself. I felt amazing. My gut issues cleared up, and I kind of my brain came back online. And then I just thought, wow, this is awesome. And I started sort of dabbling in functional medicine on the fringes of my osteopathic work, just sort of running some labs and sharing the information I had been learning with my patients, but not really charging for it. But as I got more and more confident with it, and as I had more and more experience, and I was witnessing the outcomes that were great, decided to take it another step further and enrolled in some sort of more advanced qualifications. I think the most noteworthy one would be with the Kresser Institute out in the US with Chris Kresser, his ADAPT training, Advanced Diagnostics and Personalised Nutrition. And after completing that course, in fact, on the back of that, it's where I met you, wasn't it, Stretch?
Yeah, that's exactly right, mate.
I then decided, that's it. I then decided to, take functional medicine a bit more seriously in my practice, and have developed a program around those principles. And nowadays, it probably constitutes almost 50% of my work between my hybrid between osteopathy and functional medicine. So that's kind of like how I got there. Hope that kind of made sense.
Yeah, it's great, mate. It's an awesome story. And, we really want to tap into that functional medicine practice and what you're doing now. But just to rewind there and have a look at that, what do you think was the big driving factor behind, I suppose, that journey? Your switch from, probably coming from an unhealthy childhood, smoking, all that sort of stuff, then getting into the gym, and then just sort of continuing to have this passion or this drive. What was the underlying thing that really led you down this path, do you feel?
Oh, it's a tricky one. I've definitely kind of thought about that a lot, and it's hard to pinpoint it down to one thing, but I think it was a combination of a few things. There was, I guess, certain people I met at the time that inspired me. I guess I was probably repulsed by my own ill health, especially as I started to sort of see others in that industry. And part of it was, I think, as I improved my health gradually, I just felt like I had just better ability to just think more clearly and make better choices and decisions, and started taking responsibility for my health. There was also probably a little bit of a spiritual element to that as well, because I started to sort of question my role here on this earth and what is life all about. And that kind of gave me a little bit more drive and purpose. But I don't think I can quite put it down to one thing, to be honest, Stretch.
Yeah. No, I think I can relate to that too, mate. It's like there's a passion ourselves to take care of our own health. And I think it's a snowball effect. You start doing the gym, and then alongside that, nutrition changes, alongside that, sleep changes, supplements, whatever you want to do to start to improve your own health. It's helping other people and the reward you get from that. But yeah, it's
Absolutely.
also purpose, I think. Just finding a purpose and being connected with something can make a big difference. But it's an amazing journey that you've been on, mate. And obviously there's been a huge health transformation for yourself.
Absolutely. Yeah. And, one of my passions is to just help others achieve the same, really. One of the things that, saddens me the most is just seeing people really struggling with their health and not being able to fulfill their dream, really, their passion. And so if there's anything I can do to help steer people in that same direction, that's what I'm all about.
Yeah, awesome, mate. Well, let's dive into that a little bit more and talk a little bit more about it. For those people who don't know what functional medicine is, how would you define it?
Yeah. So I guess essentially it's a framework or a thought process or a system of healthcare, you could say, that is science-based, that really focuses on the underlying mechanisms or the drivers at the root of the issue, as opposed to just treating the surface issues and suppressing symptoms. So we really spend a lot of time thinking about what's really going on, under the hood, like what's really driving the issue. And it just makes a lot of sense for people. If you have symptoms, the question is why? And I would say functional medicine is the sort of science of why and how, as opposed to the what. And I guess when you kind of compare it to conventional medicine, of which, I mean, it's amazing in certain settings, right? If you have an injury or a trauma of some type of acute infection, conventional medicine is an absolute game changer. But when they apply that same acute care model to chronic issues, it doesn't always play out well. But the difference is often, instead of just treating a symptom and suppressing it with medication, for example, we're asking the question, what's really the cause of that? And if we can understand that and we can engage at that causal level, then as function improves and health is restored, symptoms just go away as a byproduct of being healthy. So that's kind of how I like to think about it. There's lots of other ways. I mean, Mark Hyman, who's a big name in functional medicine, he describes it as a GPS system to sort of, navigate the landscape of chronic disease. And it's all about really trying to understand why we get sick and what we can then do about it.
Yeah. It's awesome, mate. It's a great message, and I think you've done well to sort of explain functional medicine. When we compare it, like you say, the conventional medicine model that we have, especially in Western society, it's all about symptom and maybe preventing the symptoms, treating the symptoms, but not looking at the root cause. And then when we look at conventional medicine, it's just like people put so much faith into the doctors and so much faith into the medical system. If I'm sick, I go and see the doctor. But why should we not be putting so much faith in the medical system?
Yeah, good question. And I don't want to beat up on conventional medicine because, like I said, it's amazing when you need them. And doctors are very well-meaning and so on. But I mean, the system that they're working within has limitations, and it's very reductionist. It will sort of break things down into these individual parts, and they have this very algorithmic approach where you present with a symptom, and if it meets this certain criteria, you get this diagnosis, and then you're given this treatment. And it's usually getting out the prescription pad, or maybe there's a surgical intervention. They cut it out or burn it off or something like that. But it's really dealing with the tail end of it. It's not really looking at the underlying causes. So you can often just be sweeping things under the rug, so to speak. And it's great for often just that relief care in the moment. If you're struggling and you need symptoms to be sort of dampened down, then by all means get relief and support yourself. But if it doesn't address the underlying issue, then those things are still going to be simmering under the surface, and they'll often just manifest in other ways. So I think it really isn't really a healthcare system at all. It's more of a disease management system. And I think we can do better. And I think if you were to focus on those underlying factors and address things at that level, then you're going to probably have a far better outcome. And, let alone the sort of side effects of some of the medications that people are taking. You'll often need another drug to address the symptoms that you get as a side effect of a medication. You know what I mean? Yeah. Does that answer the question?
Yeah, definitely, mate. It's great. And like you said, it's nothing. I don't think it's anything against our doctors. It's the system that they're being taught. And also, I think, our world is becoming sicker and more obese every year. And doctors are just becoming so overwhelmed with trying to treat people that, I think the average consult with a doctor is 12 minutes. And how much time does that give them to sit down and talk to you about your lifestyle, your sleep, your stress, your nutrition? So it's just easy for them to go, okay, what are your symptoms? That puts you in this label. You've now got this chronic disease or this health situation, and looked it up. This drug is the best thing I can give you right now. And you leave, the medical practice with drug in hand, and it might treat the symptoms and it might alleviate some of the pain and discomfort you're going through, but at what cost to your long-term health? And I think that's one thing that, functional medicine has a much better approach. And it's just helping people get to the root cause and maybe start to address some of those underlying issues.
Exactly.
Off the back of that, if a client comes into you, so if I'm feeling pain, discomfort, or I'm worried about my health and I come to see Dr. Rick, what's the sort of process that you would go through with a new client when they first come and see you?
Yeah. So, I mean, I kind of separate my osteopathy and functional medicine work out as different sort of streams or pathways. So I'll talk it through from a functional medicine perspective. So I guess normally the first point of call would be somebody picking up the phone or maybe booking a discovery call, because I have a free call and we have a little chit chat, and I just, discuss the patient's concerns and what it is they're looking for help with, their goals and so on. And I just try to sort of qualify them for my process. It's not for everybody. So, and also there's limitations within my scope of practice. So I just want to make sure that it's a good fit all round. But I usually start out with a detailed intake process where we have some intake forms to fill in. And they're, about 40 pages long. They take probably a good hour or two to fill in. So the patient has a really good opportunity to tell me all about their story, all about their health history, their symptoms, their family history, their current diet and lifestyle. So we can get a real good understanding of what's really going on with this presentation. Obviously, like you were saying, if a doctor's only got 12 minutes in a consult, how much information can they really glean and understand, right? So that's a big difference to start. Then I have the initial consultation, which is where I present to them what I call a case review, which is a clinical impression on their case. I would have reviewed their forms and studied up their sort of profile, and then I would have written up some notes. And I generally present to them my thought process from a functional medicine perspective, talking through some of the underlying mechanisms or drivers or lifestyle factors or systems disturbances that potentially could be underlying their presentation. And at that point, a lot of it's speculative. Then I will make recommendations on lab testing to objectify the workup process in more detail. So here I'd explain or at least recommend certain lab tests to run, which might include things like blood chemistry analysis, comprehensive stool analysis, hormonal testing, food sensitivity testing, checking bloods and breaths and urine samples and so on, just to really try to screen their body systems to look for functional challenges within their system. And once they sort of understand the rationale for the testing and they kind of agree to onboard in my process, we get those lab tests set up and we wait for the results to come in. And during the waiting period, I generally get people started on diet and lifestyle interventions to try and lay the foundation and get the ball rolling, centering around what I call the 4 pillars of health: nutrition, physical activity, sleep optimization, and stress management. And so we get to work on those kind of things. And then as the test results are coming in, I provide interpretations of those tests. And then we have a consultation called the results and recommendations consultation, where I essentially just present all of the lab findings and draw up a treatment plan that's very customized and then help support and guide them through the process. So that's kind of like a brief overview of what would happen if somebody comes to see me. Yeah. Other practitioners in the same space might do things a little differently, but essentially we have a workup process where we try to figure out what's the root cause. We want to identify the triggers and all the mediators that are contributing to their health issue. We want to then coach them through the process of removing those things and giving them all the resources they need to support their health. And then we kind of hopefully sort of establish a good balance and develop behavioral changes so they can implement this strategy over the long term. And then we can engage with health coaches like yourself to help with that process.
Yeah, wicked, mate. That was a great overview, and there's just so much information there to unpack. But I think it also just gives listeners a good idea of like the difference between working with a conventional doctor who's very time limited, whereas working with a functional medicine practitioner who is really going to put in a lot more effort, a lot more energy in sort of getting to the root cause of the problem or trying to help you manage lifestyle factors as you talk about to help with that. Just curious, like, who are the sort of people that are coming to you, and why do you think they come to you instead of going to conventional medicine?
Yeah, no, great question. I would say, well, to answer the second part of that question, I think a lot of the people find me having already exhausted the conventional pathway and they've just become disillusioned with it. They're not happy with results. They don't want to be taking all the medications. They think there's another way, and they're perhaps maybe interested in alternative approaches and looking into factors like diet and lifestyle. And so they'll often come find me having, been at wit's end or lost hopes in the system, and are really struggling with chronic health issues that are just being palliated at best. So that's kind of generally how they kind of find me. I mean, these days, a lot more people are interested in just health optimization and longevity as we're aging, improving the health span, so to speak. So a lot of people come find me interested in a functional medicine approach, having listened to, say, Mark Hyman or somebody like more recently, it's Gary Brecker, talking about biohacking, and they're just really keen to find ways to just really optimize their health, and they got really nothing wrong with them. So they're the kind of pathways to me, really, I would say. But I would guess common things that people come see me for would include digestive issues. So things like bloating and gas, bowel changes, constipation, diarrhea. They may have had a diagnosis of irritable bowel, or maybe even inflammatory bowel disease. They're getting reflux, etc. So digestive issues are really common. One of the most common things I probably see. A lot of people are struggling with fatigue and energy problems. They're very kind of just flat and brain foggy. They can't quite remember things anymore, and they're just concerned about their cognitive health. And this ties back to gut health in many instances. We know about the gut-brain axis, the bidirectional relationship between gut health and brain health. So that's a big part of our consideration. So there's the energy side of things. A lot of people will have hormonal related symptoms, and that could be things like sex hormone imbalances. Let's just say a pre, peri, or postmenopausal woman having issues with hormones. Also thyroid related issues, and also people just feel very stressed and burnt out, adrenal hormone issues. There's also quite a lot of people that see me with like metabolic issues, cardiometabolic health concerns. They might have hypertension, high cholesterol, and they're looking for alternative strategies as opposed to just taking blood pressure lowering or statin drugs to lower cholesterol. They might have some weight concerns and some fatty liver, blood sugar dysregulation. Perhaps they're kind of like on the path to diabetes, or even have got a type 2 diagnosis of type 2 diabetes. That's quite a common presentation. And then there's sort of like mood related issues. People often find they want an alternative to taking SSRI medication for, say, mental health challenges. They might feel anxious or depressed. And then looking for support in that respect. And then there's some people that find me because they have pain, inflammation, and perhaps maybe autoimmune type of issues. So that kind of like covers, I guess, the main things. But most of the time, you know what? It's never just one of those things. It's often all of those things all together. They have a cluster of factors all going on, a whole list. Mark Hyman loves to say he's a holistic doctor because his patients come to him with a whole list of symptoms. And that's literally my patient. It's like they've got everything going on, and it's like, what do you do? And going back to this whole conventional versus functional comparison a little bit, the way conventional medicine works is to be highly specialized in certain body areas or systems, and they break you up into pieces. So if you have a mental health issue, you see a psychiatrist. If you have a digestive issue, it's a gastroenterologist. If you have a joint problem, maybe it's a rheumatologist or maybe an orthopedist, and so on. And they break you up. And oftentimes there's no crosstalk between these practitioners or professions. And they rarely appreciate how one system has an impact on another. So all of those different symptoms could be coming from underlying system, organ system dysfunctions, and they manifest in many different ways. So, many patients essentially have lots going on.
Yeah, it's incredible, isn't it, mate? I like the way at the start you sort of referred to it as like it's alternative medicine. Like functional medicine is still seen as like alternative medicine, and conventional medicine is still seen as the primary focus. Like, I mean, you can still chat to people today or mention functional medicine, and I think there's a lot of people out there that have never heard of it or wouldn't quite understand what it was. But it's starting to gather more momentum. Like you said, there's a lot more people talking about functional medicine. You've got the biohackers, you've got Dr. Mark Amen, you've got Chris Kresser, you've got so many different people that are starting to voice up, and people are starting to switch on and listen to this stuff and hear more about it and go, you know what? Conventional medicine maybe isn't working for me. Maybe it's time I try something like this, like functional medicine. And it's great to hear that, people are coming to you to explore these different sort of options and having that open mindset. You sort of mentioned there that there could be a whole list of things that are going wrong, different underlying issues that can happen. And in that initial process, when you're meeting with clients, you're recommending sort of testing. How does that come about? Like you mentioned some of the testing that's there. Is there sort of a set number of tests you always want to see that you start with? Or how are you going about choosing some of those tests?
Yeah, thanks. So I guess, there are some testing panels that I run with most patients. And unfortunately, in functional medicine, a lot of the testing we do isn't recognized by the mainstream Medicare health insurances. So it's usually an out-of-pocket cost. So it can be a little cost prohibitive to run all these tests. But there's a handful of tests that I would typically run with most patients. And then there are other things that are more specific, perhaps, that might be indicated for a particular scenario. But let me just I'll give you a bit more of a detailed breakdown of the labs if you want, because I know a lot of people are quite interested there. So
what are the main ones, Rick? Like when you
the main ones I would say, Yeah, the main ones I would say would be good comprehensive blood chemistry. And this is the same blood tests that a doctor would run. We sometimes add a few more markers, making it a little bit more advanced. But really the difference is in the interpretation. So a good blood chemistry analysis with a functional or nutritional interpretation where we use tighter reference ranges as opposed to broad ranges, which can be much more sensitive to pick up hidden health trends and subclinical issues before they manifest as a full-blown diagnosable disease, can be really helpful. And I utilize a software that helps me kind of with an interpretation and a report there. That's a really nice way to start as a screening process that covers a lot of the bases. It's a good screen of multiple body systems. You can check in on things like your blood sugar regulation, your kidney, your liver function, your inflammatory balance, hormones, various nutrients, and lipid panel, and so on, things like that. So that's a really good starting place. It often leaves you with more questions though than answers, because it will perhaps allude to certain things going on in other systems, and it might be a little proxy or a loose inference to perhaps what might be going on elsewhere, and you might need to then explore that with another test that's a bit more specific. Another test I like to run fairly frequently, especially with my patients with gut issues, but even with people that don't have any obvious gut issues, is a comprehensive digestive stool analysis where we look at the digestive function, the process. We can look at the composition of the gut microbiome. We can get markers of gut permeability or so-called leaky gut, and we can check for things like infections, certain nasty pathogenic bacteria, perhaps parasites, or even fungal overgrowth, and just generalized imbalances in the microbiota, which can impact our health. So that's a big one. And then sort of like alongside that, I would often run a breath test called a lactulose breath test, which is to help diagnose a condition called SIBO, an acronym for small intestinal bacterial overgrowth. And it's a type of dysbiosis where you have an overrepresentation of bacteria in the small intestine, where it should be relatively sterile. And if you're harboring a lot of bacteria there, it can cause a lot of digestive symptoms like gas and bloating, bowel changes, but it can damage the gut lining and cause leaky gut, which can cause a lot of systemic inflammatory and immune type of issues that can manifest in numerous ways. So that breath test alongside a stool test is often a good way to really get a handle on what's going on with somebody's gut function. I also use a test called Dutch test. It's out of a lab based in the US called Precision Analytical. And it stands for Dried Urine Testing for Comprehensive Hormones. And it does a really good detailed dive into sex hormones and stress hormones. And it measures not just the hormones, but the metabolites, and can give you a really good understanding of how these hormones are being produced, but also being sort of metabolized and detoxified. And it gives you a really nice understanding of the integrity of your stress response. And so that one's pretty good for people with any sort of hormonal type of issue. And then lastly, I would say I do quite frequently run food sensitivity testing. Although they're not perfect, there's some newer technologies nowadays which can help to prevent false positives with respect to food sensitivity testing. And patients quite like seeing a list of foods that are likely causing an immune or an inflammatory response to help them customize their dietary pattern. And so I often will run a food sensitivity panel as well. And with all that information, we then design customized diet lifestyle strategies and supplementation plans. So that's kind of like, I guess, the 5 bulky tests that most of my patients would consider.
Yeah, that's awesome, mate. It's a very in-depth sort of look or step back to sort of get a good assessment of what's actually happening under the bonnet. It's funny that you mentioned exactly. Food allergy testing. So back when I was working as a PT in London, one of the tests that I would run with clients would be a food sensitivity test. And it was quite a reasonably priced test. It wasn't that expensive. I think it was maybe £80 at the time or something like that. They could go to a blood lab, they could give a little bit of blood, and then their results would come back, and it was like, okay, so you've got an allergy to egg whites, or you've got an allergy to this, so we could talk through it. But it was just the best way I found sometimes to get clients to actually start to change their diet. Like it's one thing to say, okay, we've got to stop eating processed foods, or you've got to do such and such. But when it actually comes back, these are the facts. Like these are the figures. This is what your blood work is telling me.
Yeah.
And a lot of clients go, oh yeah, when I eat eggs, I do feel bloated or I do feel sick. And then, you start to make some changes, and they've done
Yeah.
one test that makes them feel better. And then all of a sudden they're like, okay, well, what else can I test? Like that curiosity sort of starts to come in, and they start to see the benefits of it. So yeah, the food sensitivity was one of the first ones. And as a PT or as a personal trainer, there wasn't a lot of testing that we actually could have access to. Like most of the time you got to go to a doctor or someone like yourself to get that access. But yeah, it was pretty good in that sense.
It's amazing, isn't it, how a bit of paper can be quite a big motivator. Yeah, for sure.
You mentioned there the ranges, and I think there's a little bit we should touch on in there. So like you go to a normal doctor and you're getting, your blood's taken, and, it might come back and say, okay, your zinc levels or iron levels or whatever levels that they're testing are normal. And that's what they will tell you, that they're normal.
Yeah.
And then when they're not normal, that's when the doctor will start to react. So it's like, you're not sick, you're not sick, you're not sick, you're not sick. Okay, now you're sick. Now we've got to do something here, take a drug.
Yeah.
But the functional medicine side, like you said, you're actually starting to look at trends, aren't you? Instead of having this big range, you're tightening the ranges, making them smaller. And if something starts to head in the wrong direction, you're jumping on that like early.
Absolutely.
That's the idea, isn't it?
Yeah. That's a big difference between the conventional and functional approach. In the conventional system, it's very reactive, and they will just wait and see until you cross this line, and then suddenly you qualify for the diagnosis, and now they can intervene. And it's very sort of binary in that sense. It's very black and white. You're either sort of healthy or you're sick, and there's kind of not much in between. And the reference ranges that typical labs are using are very broad, and they represent the average sick person on the street in most cases. Just because it's normal doesn't always mean it's optimal. So we like to use tighter ranges that are considered more optimal, that will be more sensitive to pick up problems that are kind of perhaps maybe in the early stages of manifesting. And we also look at patterns between different markers to inform what might be going on with a certain system or a process in the body. And we're very interested in nutritional markers as well. So, as an example, let's just say somebody's looking at a typical blood test, and you're looking at blood sugar regulation. You might be looking at markers like fasting blood glucose or hemoglobin A1C or fasting insulin. And the reference range can be quite large, and you can have creeping blood sugar levels over time. And it isn't until you cross that line that you'd then be classed as, say, diabetic. And that's when intervention starts. And we were like, hang on a minute, functional medicine's got much more of a proactive type of approach. And we like to prevent things before they become a problem. So if we start to see blood sugars start creeping a little higher than optimal, perhaps the hemoglobin A1C, which is a sort of a 3-month average of blood sugar, starts to creep up, or perhaps insulin's just a little higher than we'd like, indicating insulin resistance and sort of metabolic syndrome, we're going to jump on that straight away. And usually it's going to be a big dive down the sort of nutrition rabbit hole for them. Perhaps maybe recommend other lifestyle factors like sleep optimization, stress management, and exercise, and some nutritional supplementation even to help improve their blood sugar regulation. But why wait until you're sick when you can kind of prevent that in the first place?
Yeah. 100%, mate. I think that's a big thing that we need to pay more attention to, because I think a lot of people go to their doctor to get a checkup and they get told that, oh, everything's normal. And then they go, oh, okay, I'm good, I'm healthy, everything's fine. And like you say, it's not until the doctor says, okay, now you've got diabetes, or now, you've got a certain chronic illness, that then they go, oh, hang on a minute, well, how did that happen? Or they're surprised in that. But, like you say, if we can get onto things early, if we can actually look at preventative instead of reactive medicine, then it's going to be life-changing for so many people. And I think that's one of the best things about functional medicine in that sense.
Absolutely.
You also mentioned, when you talked about tests, you sort of said there's a lot of tests that sort of aren't recognized in the conventional medicine. And like a lot of doctors won't do these tests, or they think that, these tests are a waste of time. Why do you think that is? And why has functional medicine been able to jump on these tests or use these tests to such great effect?
Yeah, that's a good one as well. There's a few pieces to unpack there a little bit, but I would say, first of all, there's a difference in the paradigm. So the training of a conventional doctor compared to functional medicine is quite different, and we're just looking at things differently. We're looking at it through a different lens. And there'll be certain blood tests that I might request from a doctor to run for a patient that, from their paradigm, they cannot justify, because there's clearly no reason to from from the patient's symptoms and presentation, but they're not necessarily looking at it from the same perspective. So one example that often doctors don't like running is homocysteine. And I use that as a way, well, first of all, it's sort of an independent risk factor for cardiovascular disease, and but it can give you some insight around methylation function. It can elevate with some B vitamin deficiencies, B12, 6, and folate, for example. And it's interesting from my perspective, from those nutritional considerations, but the doctor would say there's no need to run that. There's also the issue with, say, sort of pressuring the healthcare system. So Medicare is obviously going to be covering a lot of the cost of this for the general public getting blood work. And why would you be just running tests that aren't necessary from their perspective? So they don't like to just do advanced labs just to screen all systems just because it's nice to know. So there's going to be some restrictions about what will be run there, I think, from that point of view. And then we're just looking at it, like I said, from a very different perspective. In medicine, you're trying to identify disease, where in functional medicine, you're looking at disturbed function of body systems. And so the testing options that we have are looking more at function as opposed to looking to find disease. So I guess that's a bit of a difference. There is also, you've obviously got to factor in for the sort of the industry side of things as well. There's a lot of labs just wanting to sell tests, and there's an argument you can make that in functional medicine we probably rely on tests too much. And I think there's certainly tests that aren't necessarily going to be helping and aren't particularly actionable in terms of the results that they can give. So I try and kind of keep it a little bit more balanced in that respect. Did I get to that question okay there? I'm not sure if I quite answered everything there.
Yeah, no, definitely, mate. It's just like, why doctors might not run certain tests. And I think, like you say, that the Medicare system, they can sometimes see it as a big cost, but also they don't see the point maybe in running the test because the patient isn't showing disease or isn't outside this marker. So why run the test? Again, it's reactive. It's not preventative in that sort of sense. What are your thoughts around that? Just a little sidestep. Like, they say it's a big cost. Like, obviously testing is a big cost and it's a cost to our Medicare system, but also there's a lot of subsidies that go into drugs. So it's like we're also spending a ton of money on people who are sick and all these drugs that we've got to finance out of our tax system, compared to spending money on tests and preventative. In your opinion, what would you think would be a cheaper solution or long-term ongoing? What's going to be better?
Yeah, absolutely. I would say that although functional medicine can be more expensive seemingly up front, I think it's going to save a ton of money in the long term. Because, as I mentioned earlier, conventional medicine is more of a disease management system, really. And it's unfortunately heavily influenced by pharmaceutical interests, let's say. And what a great business model to keep people, sick with medications their whole life, just suppressing symptoms, perhaps maybe requiring more drugs as they develop more symptoms over time, as opposed to actually trying to really get to the root of the issue early on. You might have to sort of run more labs and do more evaluation and spend more time coaching and educating a patient up front. But then as they learn these skills and apply them to their lives and their families' lives over the long term, outcomes are generally going to be far better. And they're not going to need to take all these medications. They might not need all these interventions over the course of their life. So when you look at it from a big picture perspective, you're going to probably save a ton of money over the long term. That's my opinion.
No, I 100% agree with you. And that's very, very well answered. I think that's, just about to take that step back and look at it big picture, long term. And it's the health implications, like not only for the individual patient, but like you say, it's environment is one of the key factors and the people you spend the most time with. But if we're starting to impact the health of, our parents, and then that's having an impact on our children, it's got so many downstream effects, and it's about lifestyle, like you say, behaviors and diet, nutrition, sleep, stress, exercise, all the things that you mentioned before as your pillars of health there. So now that we've sort of covered that sort of stuff and we come to the solution side, you've engaged with the client, you've figured out a plan, you've done some testing, test results have come back, you're looking at all these sort of things, and you talked about these changes. Can you give us a bit more of an insight into sort of what the prescription is when sort of clients are coming back with certain markers that are high, or certain things that you want them to work on?
Yeah. It really just depends on what we find. So like I said, I generally kind of try to lay a foundation of health through building in those pillars of health. And I'd say, 80% of people's problems are going to be resolved if they dial those factors in. They get them eating clean, eating enough, eating the right kind of macronutrient composition, making sure that their blood sugar's stable, their good gut health as a result of their dietary choices. If they're getting to bed on time, they're getting deep restorative sleep, they're getting moving their body a little bit, maybe a little bit more intensively from time to time, and managing the stresses in their life. Like, that's the job done for most people, to be honest. When the lab tests come in, there might be very specific things that we find. So again, if somebody has high blood sugars, or perhaps maybe it's a specific nutrient deficiency, they have like low vitamin D, or B12's low, iron is low, we'll then be able to guide them through specific dietary interventions. So I have a food first philosophy, I guess, with my approach. If we can get nutrition and nutrients from whole foods, that's the best place to source them. But there's certainly a time and a place to perhaps maybe use a supplement to help bolster levels maybe a little quicker until we are in a better place. Then we can kind of taper off. But there'll be specific things I might utilize based on what we find. With gut testing, for example, it's not uncommon to see bacteria overgrowth or a dysbiotic state where there's a lot of imbalance there. And I'll spend quite a bit of time, again, modifying the dietary pattern to support gut health in general. But we also might utilize digestive support, digestive enzymes, hydrochloric acid. Perhaps maybe we use probiotics and prebiotic therapy, maybe even antimicrobials to help sort of like reduce bacteria numbers, or even anti-parasitic type of interventions if we find some type of oddball microbe there that we want to tackle. With respect to hormones, hormones are, at the mercy of many other things. So when they're out of whack, so to speak, that's not necessarily their own fault. They don't go out of whack for no reason. So we have to then try to understand what's really at the root of those issues. A lot of it comes back to, the pillars of health, stress management, and so on. But there are some specific things that we might utilize depending on what sort of hormonal imbalances we see. Somebody isn't producing much cortisol, for example, as a result of chronic sort of stress maladaptation, the so-called HPA axis dysfunction, or the sort of adrenal fatigue type of scenario. There are certain diet and lifestyle interventions that can be really helpful. Sleep is integral, stress management is critical, but there's also some nutritional therapies and some supplementation that can be very helpful as well. So we might use some adaptogenic herbs, B complex, magnesium, vitamin C, licorice root extract, for example, will extend the half-life of cortisol and effectively sort of raise cortisol. It can be really helpful in somebody's recovery. So there's lots of different examples I could give if you were to give me a specific scenario. But generally speaking, what we do is we provide generic sort of health optimization strategies that anyone's going to benefit from along those pillars of health. And then we customize it based on the individual lab tests. And that's going to be far more bespoke for them. And it can range from, some nutritional interventions through some more significant lifestyle changes.
Yeah, wicked, mate. I like it.
One thing I'll say as well there is that sometimes things come back on the labs that are certainly outside of my scope of practice. So it may include a referral to a suitable specialist as well.
Yeah, awesome, mate. That's good to hear. Like, I mean, it's great because it's such an individualized approach. There's not like a one size fits all. And, you're looking at the individual as an individual, and you're treating them as an individual, from the blood work, from the evidence that you're being able to extract from that blood work and diagnose, sort of what's going on. And it's coming back to, like you say, root cause. It's environment, it's lifestyle, nutrition, sleep, all those great things that people just need to work on. And like you say, 80% of people are probably going to feel a lot better and probably be able to
Mm.
prevent chronic disease or manage chronic disease by really
Yeah.
focusing in on those sort of things. You talk about
Yeah.
sort of like there's a bit of a general, and there's obviously the specific side. If someone's got a specific case that's, gut issues, whatever it is, you go down that line, and it might be specific supplements for that. Is there sort of general supplements that you believe a lot of us should be taking?
Yeah, there's certainly supplements that I'm pretty happy for people, for pretty much anybody to be taking. I mean, there are some caveats to that based on somebody's health issues, or there are even some genetics scenarios where you wouldn't want to be just taking certain supplements. But ideally, like I said, the food first principle is the way to go. In an ideal world, we'll be able to get all of our nutritional needs from the foods that we're eating. But the problem is that the foods that we eat today are very different of the foods we used to eat. We have issues with soil depletion. We have the effects of processing and refining of foods, depleting nutrients. A lot of our digestive processes aren't great these days because we're all stressed and malnourished, and accessing those nutrients in foods can be hard because we're not even chewing our food, let alone absorbing it. There are the impacts of perhaps maybe environmental toxicity on our nutrient needs and the stress that a lot of people are under and so on. So there's certainly a good argument that can be made for using certain nutrients just to support health and function. So I would be pretty comfortable with most patients having a good quality multivitamin mineral, typically using sort of methylated B complex within that. A lot of people are coming up short on vitamin D, so I'm pretty happy getting people on a vitamin D supplement, usually with K2 together. Magnesium is often a common one that comes up short, and so I think a good quality magnesium can be a game changer for some people. And a lot of people aren't consuming much in the way of omega-3 fatty acids, and I'm pretty comfortable recommending a good quality fish oil or krill oil or maybe a cod liver oil to provide the long chain forms of omega-3, EPA and DHA to help support health. And I don't think you can go wrong with a multi-strain probiotic on a daily basis just to cover your needs. And that small little stack of supplements, I kind of refer to as sort of nutritional assurance. They just help fill in the gap, so to speak, that might be there might be some shortfalls with your dietary strategy. So that's a good foundational strategy. And there's a lot of other things that you could potentially add to that, which might be symptoms or health issue specific. But I'll be pretty happy for most people doing that little core bundle of supplements. Yeah.
Yeah, mate, I think that's a very good list. I was just ticking them off as you're going through your head. They're pretty common things that I recommend to a lot of my clients as well. So, and like you say, you wouldn't want to just jump straight onto them. It's like they are a good base, but depending on the individual, they might not be exactly what you need right now. But for most people, I think, you've hit the nail on the head there with those sort of things that are happening.
I guess, and sort of like building on that, a lot of my patients are struggling when they come to see me, and they have got a lot of symptoms. They might be really inflamed and have a lot of pain, or they might be really fatigued and just cannot quite, put their thoughts together, or they just have a lot of bloating and gas, or they're really constipated. And in those situations, I'm quite happy to do what I call green medicine. You use a nutrient or a herb or some kind of natural compound to essentially support symptoms that they have, just to give them some relief care. Just to help kind of get them going. But if that's all you do and you're not really investigating the underlying issues, then all you're doing is an allopathic sort of approach. So I don't mind supporting people up front if there's a bit of relief that's required. I call it intelligent allopathy. You're deliberately treating the symptom with say a compound that can be helpful, knowing that you need to evaluate the underlying issue, and that's what we'll be doing. And then when we get to the root of it, we can obviously engage at that causal level, and hopefully outcomes are far better, and they can then taper off that support.
Yeah, nice, mate. I like it. A question off the back of that. So they've come to you, you've done testing, all these things have gone through, and you've got this prescription of, okay, we've got to change your diet, we've got to work on stress management, you've got to exercise. Like there's all these things that have got to happen, and they're not necessarily easy things. People are stressed, people are limited on time, so many responsibilities. how do people go changing their behaviors? Like, how have you found working with your patients and giving them this idea of like all these things that need to change if you're going to be able to fix your health concerns? How does that go for them, and how does that go for you?
Yeah, I mean, it can be a little bit mixed. I would say from the start, actually, I have a particular sort of process of onboarding a patient, and my process is almost like a filtering process for people that aren't really ready for change. They're not really committed to the change, and so most people I work with from the get-go are people that are all in on their health. And so I don't find it that hard to get people to make these changes because they're ready, willing, and committed. They're at that state of change that they can jump right in and get involved. That being said, there are certain people that claim to be ready, and they manage to get through the filtering process, and they might struggle implementing some of these things. In that case, we just obviously have to really anchor to their why. Why is it they really want this, and just come back to that, because they obviously don't want symptoms, and they want to be able to live the life of their dreams, essentially. And I think keeping that in mind is really helpful as a motivator. Then life gets in the way, and people have self-sabotaging type of behaviors. We sometimes have to just break things down a little bit and do them more step by step. Go for the low-lying fruits and just implement some simple changes to start with. And then as they gain momentum and they see the results, they're often much more motivated to then take on the next challenge. This is often the point where I might have to reach out to somebody better trained in, say, the health coaching side of things, like yourself, where you can kind of get down on their level a little bit more and really start to engage with them and figure out what's really making the issues, what's making them come unstuck with this. So there's that. There's that. But others are just sort of so desperate and ready and they're financially committed to this process, that they sort of run with it. My process as well, which I haven't really described in much detail, is a sort of commitment to a 3-month process where we have fairly regular contact with check-ins, and they're supported, and I hold them accountable. And if they have questions, I'm accessible to them. So I'm very responsive to those questions. So I find that people that are doing it this way have that support and guidance that they need to succeed. But even so, you do come up against some situations that we try to troubleshoot as it comes about. But going back to, say, maybe the average person that's not quite ready yet, then I think having a health coach on board like yourself would probably be the better way to go. The step-by-step approach they might do much better with.
Yeah. I like your approach, mate. It sounds great. It's like, you're making sure you're assessing them before they come on board and they invest all that money. Are they actually ready for change? And are they willing to put in the work that it's going to require? Because it is going to require big lifestyle changes when we're looking at this functional approach. It's not a quick, okay, here's a drug, take a tablet. It's not this quick fix, prevent the symptoms or cover the symptoms. It is actual lifestyle changes, and it is really going back to all the key things, all the key pillars that you talked about. But I also like the way you said, and I think it circles back to your own story. You talked about at the start of like just getting involved in fitness, and then that making you more curious about nutrition and making you more curious about functional medicine and osteopathy. And it's a snowball effect. If you can make one small change, generally it's going to lead to more changes, and it just continues to roll and continues to grow. And step by step, you start to move towards that person you want to become, the health results you want to receive, the purpose that you're driving for in your life in that sort of sense. So it's a great approach. And for people who are ready to make change, I dare say that, it's going to work well for them in that context.
Yeah, absolutely.
Just with an eye on the clock, mate, we're sort of getting close to the end, but I'd love to hear maybe a case study. Like, is there a certain client or a certain case study you could maybe share with us? Someone that has maybe come to you and the conventional medicine system has failed them, and maybe they've come to you as a last resort, and someone that you've managed to help just through the functional medicine practice that maybe couldn't have got the same solution through conventional medicine. Is there a case study you might be able to share with us?
Yeah, I mean, there's two that I wanted to bring up, but I'm just trying to think, if time's a bit of a limit there, maybe we should just do the one. Okay, so a certain patient comes to mind. This is not too long ago, actually, maybe just a couple of years back. Had a what you might call a train wreck type of patient come in with all the symptoms, So the predominant presentation was a lot of bloating and gas. So an irritable bowel diagnosis, a lot of constipation, loads of reflux. But she also had a lot of post-menopausal symptoms, hot flashes, night sweats, just really struggling to lose weight, hives on the skin, so a lot of skin reactions. And she just couldn't eat foods that she wanted to eat. Like I remember her saying that she can't enjoy an apple, because she just bloats out like she's 9 months pregnant and so on. And so she was sort of desperate for help. And she was obviously over the medications. She was on proton pump inhibitors and antihistamines, and I'm not sure exactly the others, but she was basically medicating the symptoms, which is typical. And so we went through the onboarding process. We did a deep dive. Lots of things come back on testing. She had a fairly common bacteria infection in the stomach called Helicobacter pylori, probably in part contributing to the reflux and a lot of digestive issues. She tested positive on a breath test for SIBO. So she had a bacterial overgrowth in the small intestine, likely contributing to a lot of the digestive symptoms, but perhaps even more systemic things. Hormonal imbalances, like she had like low estrogen and progesterone, as you'd expect being postmenopausal, but the progesterone was relatively lower, what we call is sort of like a relative estrogen excess, and her stress hormones were kind of all over the place. Basically like a real train wreck with respect to health, but I like to see that as lots of room for improvement. And so we got to work and we did all the things. So we started out with a elimination diet. Kind of I sort of use a elimination provocation strategy to get on to an anti-inflammatory, nutrient-dense type of diet and cut out all of the common food allergens and the junk. Got off sugars and refined foods, processed foods, cleaned out the diet, so to speak. And that was sort of like a big foundation. And because of the SIBO presentation, we also had to factor for some of the fermentable carbohydrates in the diet. Foods we class as FODMAPs. We had to sort of limit those for a period of time. We did some nutritional support, got her on pretty much the sort of bundle I mentioned before, but also we did some antimicrobial interventions to try to actually reduce these bacteria numbers. We used some herbs to help with hormonal regulation, and we did some anti-inflammatory strategies as well. And, a couple of months in, symptoms were improving significantly, bloating had settled down, joint aches and pains. And I remember her just saying that her husband had been sneaking garlic into food, whereas like normally she'd like bloat out, but he was sneaking in there and she wasn't getting bloated. And towards the end of the process, she was sort of celebrating with me because she was able to eat an apple without getting bloated at all. And she actually left us a review, like a Google review, but she delayed leaving it because she wanted to see, actually, is this going to last? And that's when she wrote the review. She commented, I think, on that fact, delaying it, and the results are sort of maintained over the long term. So that was a really nice sort of recovery process for somebody going through this sort of work, and that's pretty typical. That's pretty typical.
Yeah,
but
awesome,
there's
mate.
an interesting case. But the options for her was just basically just to take medications to suppress all of those symptoms over the long term, and it's either going to stay the same or get worse. And so she was pretty happy with the outcome that we got when we dug into it and figured out what was going on and really supported her along the way.
Yeah, wicked, mate. It's a great story to share. And I think, a lot of people have those struggles and they just accept them. Okay, this is just normal gas, bloating, whatever these symptoms are, and I'm trying to suppress them, but this is my life for now. But it's amazing to see what can happen, when they work with someone like yourself, who does the deep testing, who can figure out maybe root cause, and then just start to work on simple changes, simple things, maybe a few supplements. And in a couple of months, this lady's just had a life-changing experience, which is just must be so rewarding for her, but also for you, mate, to be able to help people like this.
Yeah, no, it's a privilege. I absolutely love the work. I love helping people. I just wish I could help more people. Yeah.
Let's get on to that, mate. If people want to contact Dr. Rick and potentially work with you or chat to you about their health complications, whereabouts can they get in touch with you?
Yeah, I'd say the best place to get in touch with me would be via my website, and that's thehealthformula.com.au. I'm not particularly active on socials, although you might find me on Facebook and Instagram, but I'm pretty busy these days, so I'm not too active there. But you're welcome to reach out to me. You can book a free discovery call that I'm offering at the moment, where we can sit down and chat through your issues for 30 minutes and just see if it's a good fit. I'll outline my process, and if it's of interest to you, you could consider joining on. If it's not a good fit, I'll certainly do my best to steer you in the right direction. Feel free to email us as well, info@thehealthformula.com.au, or if you want to get to me directly, rick@thehealthformula.com.au, and I'll be more than happy to answer any questions that you might have. Yeah.
Awesome, Rick. That's wicked. I'm sure people will reach out and get in touch, and it's great for you to come on the show and talk through, just a bit about functional medicine, what it is, and comparing it to conventional medicine. So I really appreciate your time, mate. Thank you.
Mate, thanks a lot for inviting me on. It was really good fun.
Thanks for tuning in to the Midlife Mavericks podcast. Remember, your journey to optimal health and vitality doesn't end here. You're just getting started. Keep embracing the mindset of a maverick. Stay committed to your visions, values, and goals. Continue taking meaningful steps towards a life filled with energy, purpose, and fulfillment. Until next time, keep thriving and living a life on your own terms. Cheers to your journey beyond 40.